I have back pain, and I've had back pain since I got into an accident in LA, one of those multi-car accidents, and yeah, I was 13, my mother was driving, we were the first car that got hit, and subsequent
terrifying.
hits in the back.
But you look fine.
Thank you. And didn't feel anything other than just, felt weird for the first week, and then couldn't get out of bed. And so for years I went through traction therapy and lots of shots in the back.
Epidural steroids?
Yes,
Steroids, I don't think I ever went through epidural. They were just into the muscles, I believe.
Okay.
Um,
So you like trigger points.
yeah,
What kind of doctor were you going to at the time?
I believe they were orthopedic.
Okay. And you never had surgery, you didn't have a disc or anything like that?
Did not have surgeries at that time, no. And so that was obviously the upper back. And then,
That wasn't obvious to me. Thank you.
oh, I'm sorry.
Yeah, yeah.
So upper back, and it took a lot to get it under control, and it just kind of.
And did chiropractors help or anything like that, or did you see them?
You know, at that time, I never went to chiropractors because my mother was a nurse. And
Different, but that's like a Hindu going to a Buddhist, right?
Yeah.
Yeah.
So I continued with the traction and also lots of pain relievers and lots of muscle relaxants. Did the traction through college. They tried to discourage me from doing a variety of different things like bicycling or surfing. Anything that would extend my neck up. But I didn't go with that. And did the
Yeah,
biking
maybe.
and did the surfing and actually even went into archaeology, which meant a lot of shoveling and doing that kind of thing. And actually even went into having a home furnishings shop, and so there was a lot of lifting of furniture. And
What did
then,
surfing do for you?
Well, I was supposed to stay away from it because I
Right.
do this.
But you did it anyway, so what did it do for you? There's something that had you do it.
It was exhilarating.
Yeah.
Yeah.
There's nothing exhilarating here.
Enjoyment.
But let's see. After a while, I started developing lower back pain. And what I was told was, well, upper back pain a lot of times surfaces as lower back pain also. And lower back pain started kind of taking over the upper back pain to the point where I'd end up in the hospital for a week on morphine. And all of that, I guess I just kind of look at as being, well, if you mask the pain and you don't care about it, then
Wow. You go into the hospital for a week on morphine because of the pain in your low back.
because I couldn't move. In fact, I do remember paramedics coming into my house, putting me on morphine to get me out of the house.
Yeah.
As I was basically just trying to tear my face off.
Yeah.
And it came from getting into bed.
Yeah.
So after going into the hospital, I was on a lot of different things. And Lyrica.
So your mom's still winning. You haven't been to a chiropractor yet, have you?
Oh no, I
okay.
had started going to chiropractors. I've done acupuncture. I've done acupressure. Done a lot of massage. Yes, reflexology.
Oh, you did that?
I did.
Oh,
yes.
my God.
Different kinds of acupuncture. There's kind of a mate thing that tries to combine Western medicine
Mm-hmm.
with East Indian stuff, and Far Eastern stuff. And through all of this, I've always had skin situations with, eczema or atopic dermatitis, which tends to flare up whenever something strange is going on, either stress-wise or pain-wise, which of course creates stress. And being on drugs for that, usually steroids, heavy doses of steroids. was-
Which thin your bones and might make your back worse.
Topically and, yeah. Had a lot of injections for the pain
Uh-huh.
in terms of steroids, both at the top and the bottom. Was just told.
Now, have you ever gone to like a radiological suite where you were under a
Fluoroscope.
fluoroscope and they're getting it just in the perfect right spot? Or has this been an injection at the doctor's office with some?
No, this has been at the hospital where it's been under an X-ray.
Yeah, okay. So that's an epidural steroid,
Oh.
or a facet joint injection or something like that.
Okay.
Yeah,
Okay.
okay.
Did that here, done in Anaconda, and
Mhm.
also up in Great Falls.
Okay.
Actually, up in Great Falls, it was kind of cool because they let me watch the screen, and that was nice.
Yeah.